So I think we can all agree that the statement that's up on the slide right now is a truism, that benzoyl peroxide is the most effective and important single agent that we have for treating our patients with acne, at least topically. But the problem is that now it's not quite as available for us. Benzoyl peroxide is no longer available by prescription with the exception of possibly one product. Otherwise, we're sending our patients into the pharmacy for over-the-counter products, and they've got this bewildering array of products to choose from. They're choosing things that perhaps are not quite as efficacious, or certainly not, or perhaps a little bit less tolerable than something that we would wish for them to have. We know that benzoyl peroxide is kills bacteria, kills the P. acnes more efficiently than do the other topical antibiotics, but also that benzoyl peroxide alone significantly reduces inflammatory lesions and non-inflammatory lesions as well, as benzoyl peroxide is mildly comedolatic. But the most important thing as far as I'm concerned, not only does it make the acne better, but also it helps us to fight the ongoing problem of antimicrobial resistance. Benzoyl peroxide is not associated with antimicrobial resistance. If you co-apply benzoyl peroxide along with a topical antibiotic, or take it along with an oral antibiotic, you reduce the development of resistance of antibiotic resistance. And also, Jim Layden showed us that if you have a patient who has already become resistant to an antibiotic, if you add a benzoyl peroxide wash, you can actually reverse the resistant state. So you can, if you didn't start off with benzoyl peroxide in the beginning, you can actually make their antibiotic work better. And here we see the relative efficacy of the topical antibiotics at killing P. acnes. Here's benzoyl peroxide in the center, a very effective medication as a leave-on in reducing P. acnes counts. You see here a 2-log reduction in P. acnes counts, whereas clindamycin and erythromycin give you only about a 1-log reduction. It's important to realize that a 2-log reduction is actually almost 99% reduction in P. acnes. So the clindamycin and erythromycin down at 1 log are still obviously effective medications. However, we have to realize that this study was done in 1992, and erythromycin since then has become a no-go in most communities in treating P. acnes. So if we were to repeat this study today, I would hazard a guess that erythromycin would be down at around the level of azelaic acid in its ability to actually kill P. acnes. Now, if you combine benzoyl peroxide and clindamycin, as we see in 3 of the combination products that we have available for our use, you do see a 3-log reduction. So the addition of clindamycin to benzoyl peroxide does give you a little bit of a boost. But remember, the difference between a 2 and a 3-log reduction is incredibly small. We're going from 98.9% to 99.2%, right? So although statistically significant, the difference here between benzoyl peroxide as a standalone leave-on and the combination products with clindamycin is 1, maybe 2 papules. So it's not going to knock your socks off. The benzoyl peroxide is the workhorse in the combination product. Sorry. Most of us prescribe washes when we use benzoyl peroxide because we're well aware that teenagers especially are only going to use 1 product a day. And sometimes we think that a wash is sort of a give-me, right? It's an additional product. Well, they had to wash their face anyway, we might as well give them some benzoyl peroxide. The problem is that the washes, at best, give you a 1-log reduction in P. acnes. So about a 75% reduction in P. acnes. Additionally, the washes have not all been studied for substantivity. In other words, that the benzoyl peroxide is still on the skin once the patient rinses and dries off. Only 3 demonstrated substantivity, and all of them are now gone by the wayside since we can no longer write prescriptions for these medications, although Bravoxyl has resurfaced as Panoxyl creamy wash and is available over the counter. So the washes give you less P. acnes reduction, and there's absolutely no data whatsoever on the generic washes. So if you're sending your patient to the pharmacy to get a benzoyl peroxide wash, you haven't the faintest idea what they're actually getting. They may be intolerable, and also, as we know, when the FDA allows them to be a generic add-on, all it has to be is the right concentration of the active ingredient. So yes, it's 5% benzoyl peroxide, but is it efficacious? Don't know. Study's not done. Does it cause intolerance? Don't know. So a couple of thoughts on washes that occur to me on a regular basis. The first is that none of the studies on benzoyl peroxide washes looked at the rinsing, right? Surely, after you wash your face, you're going to rinse your face before you dry, and no studies have looked at how long it might be rinsing and how much might be rinsing down the sink. Also, what about the timing of the use of the benzoyl peroxide in the shower? Do you tell your patients to make sure the benzoyl peroxide is the last thing they use in the shower? Because otherwise, if they wash first and then they lather, rinse, repeat, and then put on their conditioner, most of the benzoyl peroxide is probably dripping down the sink. The other thing is no studies have ever looked at how many foot-pounds of pressure the patient used while wiping off. And surely that matters, right? You've seen teenage boys, they put the towel on their face and they move their face instead of the towel and really scrub. If the towel gets bleached, where's the benzoyl peroxide? Probably not on the face. So I have problems with washes. So I think that it's very clear that even with the good substantive branded washes, that leave-ons give you a better ability to kill P. acnes than do washes. But the branded products, again, hard to find. So we have, as the innovation today, Efficacy Duo. Efficacy Duo is a combination of micronized benzoyl peroxide at 5.5% and LHA at 0.4%, which is added as an exfoliative. So the more uniform distribution with the micronized benzoyl peroxide probably reduces the irritancy, as we'll see in a second. And the LHA as an exfoliative has been found to be 5-6 times more effective than salicylic acid. And what this does is allow more benzoyl peroxide to come into the skin, as well as giving the skin a smoother and more uniform appearance. So here's what happens when you micronize benzoyl peroxide. On the left is your standard benzoyl peroxide that has large clumps, and where those clumps land on the skin might actually cause additional irritation, whereas with the micronization, it's more distributed evenly throughout the gel. The LHA at 0.4% is a desquamating agent, just as salicylic acid is. It's going to chew away these beautiful desmosomes that are keeping the corneocytes attached. But LHA does a precise cell-by-cell exfoliation, as opposed to what salicylic acid does, which is just grab a hold of a whole clump of epidermis and pull it off all at once, increasing the irritation and perhaps the erythema that you might see with a salicylic acid product. So how well does this stuff work? I'm sorry, this thing is incredibly touchy. How well does the stuff work? Well, there's a head-to-head between Efficacy Duo and Benzaclin, and in both arms, tretinoin 0.025% was used at the same time in order to mimic the way we generally treat our patients with a topical antibiotic and a topical retinoid. As you can appreciate here, in both inflammatory lesions and non-inflammatory lesions, absolutely no difference between Efficacy and Benzaclin. In terms of tolerability, identical tolerability, with very minimal signs of either objective or subjective intolerance. So no difference in terms of the speed in which it acted, nor in the total reduction in inflammatory and non-inflammatory lesion counts at the end of the study. Drive me crazy. How did the patients feel about it? The patients felt that their skin looked smoother and softer, and that the blemishes were less visible, and that was statistically significantly different in favor of Efficacy Duo. Equivalent evaluation on the improvement in other parameters like skin tone, redness, skin brightness, and overall skin appearance. So here you have a clinical slide showing you from this study. On the top line is Efficacy Duo plus tretinoin 0.025%, and the bottom line is the time frame for Benzaclin plus 0.025% tretinoin. So you can appreciate that both drugs did a wonderful job in the reduction of both inflammatory and non-inflammatory lesions, and no difference between the Efficacy Duo and the Benzaclin. So the summary is that Efficacy Duo is as effective as the prescription combination product at reducing both inflammatory and non-inflammatory lesions, with good cosmetic results as well, thanks to the LHA, and very well tolerated. Because we have very few branded products available for us anymore, it gives you the opportunity to send the patient into the pharmacy and acquire the very specific product that you want them to have, rather than just sending them out blindly to the pharmacy for over-the-counter benzoyl peroxide. Prior authorizations are the ruin of our lives these days, and from where I'm thinking, this gives me the opportunity to spend my time worrying about the prior authorization for their retinoid or for their designer oral antibiotic, and while they're going to the pharmacy, pick up their Efficacy Duo, which is safe, effective, and cost saving not only for the patient but for us as well, since we don't have to deal with the prior authorizations. So that's the innovation that I wanted to share with you today. And I thank you very much for your attention.